Hey guys, welcome back to the channel. So on this episode we're discussing HPV vaccine and cervical cancer. So basically the cervix exists between your uterus and your vagina. Your vagina is the region after your labia. It can be accessed during sexual intercourse by the penis. Then the cervix is the opening to the uterus. So basically it's vagina, then your cervix, then the uterus. So cervical cancer is cancer of the cervix.
To me, faith is like HPV. Okay? It's like no one really talks about it, but at the end of the day, we all have it.
So basically, most of us have the virus within our systems. We have the HPV virus infection, but our immune system is able to clear the virus so that it does not cause cancer. But for some people, this is not the case. So the virus exists in their bodies over a long period of time, making the cells cancerous. So cancerous cells, they reproduce fast and they don't die. The HPV virus does not just cause cervical cancer alone. It also causes anal cancer, oropharyngeal cancer, throat cancer, vaginal, vulvar cancer. It causes all those cancers. And the signs and symptoms of cervical cancer include bleeding between menses, in that people usually bleed from day 1 to 5 of the menstruation cycle. So you find yourself bleeding from day 6 to day 28. That could be a sign of cervical cancer. If you bleed after intercourse, that's also a sign of cervical cancer. And if you bleed after menopause, that basically, if you have regular periods and you notice something that is not within the days that you usually have your periods, you should be worried. Then there's also discharge, a foul odor. This discharge has foul odor, and sometimes you can also notice blood on this discharge. There's pelvic pain. Pain during urination and incontinence are the two symptoms of cervical cancer that one can confuse with a UTI. Then patients with cancer also experience severe weight loss, like you lose unexplained weight loss. You lose many kgs over a very short period of time. Your legs could also swell in case you have cervical cancer. So there are patients who are more likely to be infected by certain disease because of they have things that predispose them to this disease. So for cervical cancer, STIs like STDs and STIs, weakened immune system, because you need the HPV, you need your body to clear the HPV virus. If it's unable to clear the virus, then you definitely get an infection of this, and the HPV will last in your system long enough to cause the changes in the cells. Then smoking is another risk factor. Basically, smoking and alcohol is a major risk factor for most cancers. Yes. Then having many sexual partners, because HPV is essentially like cervical cancer. You can talk of cervical cancer as essentially an STI, because it is caused by a virus that is transmitted sexually. So having many sexual partners will predispose you to getting a HPV infection, which could possibly lead to cancer. Then not practicing safe sex, could also increase your risk of getting cervical cancer. Having 3 full-term births puts women also at risk. If, like for example, you're married, you have 3 siblings, your mother has had 3 full-term births, that predisposes your mother to the risk of cervical cancer. The theory is that the hormonal changes that occur during pregnancy trigger some changes in the cells, possibly trigger some changes in the cells that could lead to cervical cancer. Then if you are pregnant before the age of 17, that's also a risk factor for getting cervical cancer. If you have a HIV infection, if your family member is infected with has history, or if you have a family member who had cervical cancer, which basically is family history of cervical cancer, that's also a risk factor. Then the use of birth control pills also predisposes one to getting cervical cancer. So to prevent HPV cervical cancer, we have screening tests like PAPSMEARs and the HPV vaccine. For the PAPSMEAR, A speculum is used, which can be metallic or plastic. Looks somehow, okay, I'm just going to demonstrate. It does not look like this, but it opens your cervix so that the nurse is able to use, is it a swab? Something like a swab to take cells from around your cervix. The cells are then analyzed in a lab to see if there are any cancerous cells. Before cells become cancerous, they're usually within, HPV first infects them, then they go through a precancerous state. So most of the time when a pap smear is done, we find the precancerous cells. These precancerous cells can be treated so that they don't become cancerous. So that's why pap smears are very important, because they're able to, it enables the medical professionals to capture, or rather get the cells when they're still in their precancerous state, so that the treatment is given so they don't end up being cancerous. If you're in the age bracket of 21 to 29 years, if you go get your pap smear right now, you'll wait for, and it turns out to be normal, you'll wait for at least 3 years before you get the next pap smear. So you'll be getting pap smears every 3 years. Then if you are from the age of 30 to 65, this is also just the same thing. If you are getting a pap smear today and it turns out to be normal, you'll get another pap smear every 3 years. So for the people who are 21 to 29, the option of a HPV test is not there as a screening method. But from 30, HPV test can be used as a screening method. So if you're tested for HPV, if you are 30 to 65 years of age and you're tested for HPV, the virus itself, but remember that the test will still be done by collecting cells from your cervix. If the test is done today and the test for the HPV turns out like you don't have any virus within your system, no infection, you'll wait for 5 years before the next test. If you take a pap smear, just a pap smear only, you'll take it every 3 years. If you take a HPV test plus a pap smear, you'll be taking it every 5 years. So for the HPV vaccine, between 9 and 14, like anyone above 9 years can get the HPV vaccine. If you are 9 to 14 years, you receive 2 doses of the HPV vaccine, 6 months apart according to the CDC. If you are above 15 years of age, 19 to 14, 2 doses. Above 15 years, there are 3 doses, 6 to 12 months apart. There are studies claiming that a single dose of the HPV vaccine can also be effective. But right now the CDC guidelines say 3 doses for those who are above 15, 9 to 14 is 2 doses. Remember, the government had rolled out the vaccines, free HPV vaccine for children 10 years of age. So if you have a 10-year-old in your family, you go get them vaccinated at the nearest public health facility. So while doing research on this video, I told you guys I'd go visit a clinic. I visited Imperial Medical Clinic, the one in Parkland. The hospital was clean. I liked that. The people were nice, the nurse was nice. The sample collection process was not as difficult as I imagined it would be. It was very easy. I was very comfortable through the whole time. I did not have any issues basically through the whole thing. But Sasa, after they collected my samples, it has been a week. Did not get my invoice for my payment. Have not received communication about my pap smear results. I don't know when I will be receiving the vaccine, because technically you have to do a pap smear, get the results first before you receive the vaccine. The package that is 5,500, I like it because it covers like a wide range of services and has HPV included. Like it has the HPV vaccine plus the pap smear, so, and the breast exam and the gynecological review. So that's why I liked it, and hopefully within the next week they'll get back to me, and on the next video I'll be telling you how the experience was wonderful. Okay, bye bye.